I understand that viruses have been a serious problem in part because they can mutate. Would it be possible for viruses to mutate in such a way that they would be immune to the effects of humic acid?
Viral mutation is, of course, a very big problem in the development of any pharmaceutical material for therapeutic uses, as well, of course, for prophylactic uses as well. One of the advantages of a humic acid is the mechanism of its action, and that is that it prevents viruses from binding to cell surfaces, which all animal viruses have to do in order to reproduce. If you can prevent that step of attachment, where the virus literally attaches physically through chemical bonds, primarily hydrogen bonds, to a cell surface, then you can prevent the virus from reproducing. And if you can prevent the virus from reproducing, then of course you've beaten the virus, because it will only last one generation. And viruses don't live forever in vitro. Herpes viruses live for maybe 36 to 48 hours at most, if they're not allowed to reproduce. So that action of viral fusion is the way humic acids work. It's one of the aspects that gives rise to humic acids being broad spectrum. All animal viruses have to reproduce that way, so if humic acid is able to attach to a binding site of a virus, irrespective of the geometry of the viral binding site, then you can prevent viral attachment in very many types of viruses. It turns out that that is fortunate also from the standpoint of viruses being able to develop resistance. Viral fusion inhibitors generally are found to be very difficult for a virus to beat in terms of mutation. And the reason is that in order for a virus to beat that mechanism, to mutate, so it would avoid that kind of action, the virus has to change in the way it reproduces. So it would be, for example, like saying to a cow, okay, we don't want you to reproduce anymore. You have to develop some other mechanism of reproducing other than the normal way that you reproduce as a cow. Well, that may be possible. It may be conceivable in X number of millennia that a cow could do that, develop a different way of reproducing, but then it wouldn't be a cow. And the same is true of a virus, animal viruses in particular. A virus may in fact develop some new way of reproducing itself other than by attaching to a host cell. But if it does, it's then no longer a virus. Then you have a different kind of problem. And as I said earlier, in the case of viral fusion inhibitors, of which there are a number of very well-known examples other than humic acid, both synthetic as well as natural product, some of which are available as prescription drugs, others of which are under development at the present time. Viral fusion inhibitors generally are very, very difficult, if not impossible, for a virus to develop immunity to. And that's another very favorable aspect of the use of humic acids to fight viruses. In the case of humic acids themselves, it's important to realize also that the size of the humic acid molecule is very important. The smaller molecule versions, sometimes referred to as fulvic acids, tend not to be that effective as antiviral agents. The larger molecules, humic acids, tend to be more effective as antiviral agents in terms of their efficacy. The reason is that the larger humic acid molecules are better able to conform to the geometry of a viral binding site. Each different type of virus has a different kind of surface protrusion, if you will, like a sticky mushroom that comes out of the surface of the virus that it uses to attach to a host cell. Something like a lock and key mechanism, where the virus has a key on its surface, and it inserts that key into a lock on a cell surface. The different kinds of keys go with different kinds of viruses. Well, it's important that humic acid have a large enough size, molecular size, such that it can bend and twist and conform to whatever the geometry of the viral binding site happens to be.
So how important is viral fusion in battling viruses?
Well, the matter of viral fusion inhibition is very important. For example, one drug for AIDS was developed and synthesized just for a particular binding site on the surface of the AIDS virus. The molecule is relatively small. It's very difficult to produce. It costs $18,000 a year on top of the normal AIDS drug cocktails, which are about $15,000 per year. Requires injection twice a day, so it's very difficult to administer. However, the difficulty with this small molecule viral fusion inhibitor is that the AIDS virus is now about 15% resistant to that particular drug. The reason is the binding site geometry has changed slightly. So the initial approach by that particular company was to determine the exact geometry of the binding site and to synthesize a drug that would exactly fit inside or attach to in an exact manner that binding site. When the binding site changed, modified, mutated, whatever term you'd like to use, but it changed somewhat, that drug then no longer will be effective. In contrast, viral fusion inhibitors, which are polymeric in nature, that is, are very large molecules, don't by and large become affected by small changes and even relatively substantial changes in a viral binding site in terms of the geometry and in terms of the drug, or in the case of humic acid, the natural product material no longer functioning. That just doesn't happen with polymeric molecules. And that's an important distinction to note, that in the case of small molecules synthesized for specific binding sites, the lifetime of the drug, that is how long, a period of months or a few years, the drug will be in fact efficacious, is very limited. In the case of humic acid, that's simply not the case. Humic acid will be efficacious for a very long time when the material is isolated, purified, and processed in the appropriate manner for human health usage, both in terms of prophylactic as well as therapeutic applications.